Hi, everyone. Thanks for tuning in for this brief overview of the volunteer guide. And thanks for your time volunteering with the Special Olympics of New Jersey Summer Games. So this is a overview for health promotion volunteers. In health promotion, we're going to focus on screening and education rather than something like diagnosing or treating. When you arrive for your volunteer shift, go straight to the Lions Stadium at TCNJ, and there's a global volunteer check-in, and they will give you a t-shirt. Then come on up to the Brower Student Center on the second floor. As you can see in this map, these are stairs here. You come up to the second floor and look to your left, and that's where health promotion setting is. You can store your things and sign in. I'll send you this as a PDF as well, but I want to highlight a few aspects of working with Special Olympics athletes. Some things to take note of here is to really be yourself, be professional, try not to talk down to any of the athletes, enjoy a sense of humor and any interactions you're going to have, and really kind of treat them just like your peers, treat them like any athlete you would interact with. In health promotions, you're going to work in screening teams with 1 to 2 other volunteers at each station. We'll rotate stations throughout the day or throughout the shift. And there are a couple of forms. There's a couple of pieces of paper that each of the athletes will carry around with them. And then the last station is checking out, and there's a little data entry to be taken care of as well. So these are the stations in this triangular shaped kind of open area that we have. The athletes enter and exit at the same spot here. And like I said, you'll go to check-in first, and they will get a couple of these forms, and we'll pull them up onto the little iPad-like tablet that we have. And then the athletes will go to height and weight and BMI, and then over to blood pressure at these 2 tables. And then they'll come to the nutrition, is usually set up in the corner here. And then among these 3 stations, sun safety and hand washing and hydration, usually around the middle here, and then bone density here, and then checkout. Now I'll go through some of the different stations. So check-in, the 2 different forms we have are the Special Olympics of New Jersey HAS or HAS form, and that is where we do data collection for the Special Olympics. This other form here with the green or perhaps gray on top, I'm not sure if it'll be printed in color, this is the athlete data form. We're going to capture some of the information from the HAS form and provide it on the athlete data form so that the athletes can take this with them and give it to their primary care provider for some useful information. The athletes will also have this badge that looks kind of like this. And each of these symbols represents a different section of the healthy athletes. And they'll have this on their lanyard as they check in as well. Then, like I mentioned, the height and weight and BMI station. This is a close-up of what's featured on the Haas form. You're going to just measure height and weight and then calculate the BMI using a calculation wheel that we'll have available. We're going to skip waist circumference. And depending on the age, there's 2 different ways to calculate BMI. The next station is blood pressure. For health promotion, blood pressure is going to be checked by a health profession student or a licensed healthcare professional, someone who's been trained in taking blood pressure. We're going to take it manually. Excuse me. And there will be anybody who's out of range should be reported to myself, one of the clinical directors on staff. The next station is nutrition. This takes a little bit longer. The athletes are going to sit down across from you. We have some food models. We have a number of questions to go through. You can have a nice conversation with them. And it does, like I said, it does take a few minutes. Sun safety, hand washing, these 2 areas, sometimes we have some giveaways available. These are some examples of the questions that you'll go over. And it's okay if they do these out of order and then, perhaps do sun safety and hand washing and then go back to nutrition. That is completely fine. Same with hydration and physical activity. Really, the order of the stations is not important. Bone density, this will be kind of on the far wall. This is for athletes who are 20 years or older. This is a screening test that takes an ultrasound of the heel bone or the calcaneus using an ultrasound machine. And again, it's a screening test for bone density. And we'll have a couple of volunteers trained to do this throughout the day. It does take a little extra training. So if someone's going to be there both Saturday and Sunday, this is a great station for you because you'll just have to go through the training once. And then the athletes will come to checkout. This is a part where we'll compare the complete data on both of the forms, and the athlete will get a sticker right here by the green apple that represents health promotion. They'll get a sticker on their badge to show they've completed this part of Healthy Athletes. And then they can go. We will keep this Haas form. We'll make sure that all the information is completed here. And whatever we've collected on the Haas form, we want to make sure that the athlete gets their copy of it on the athlete data form, and we'll give them that to keep as they go on their way. That's about it. I look forward to seeing you this weekend, and please reach out via email if you have any questions. Thank you.